The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking. Conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name's Nesh Nikolic, and today I have the privilege of speaking with Dr Simon Byrne, a clinical psychologist and researcher whose work delves into anxiety treatments for both adults and children. Dr Byrne completed his PhD and Masters of Clinical Psychology at Macquarie University with a focus on child anxiety. Since then, he's held postdoctoral research positions at Yale University, Westmead Hospital Psychiatry, and the Royal Prince Alfred Hospital Drug Health Unit in Sydney. He is now a lecturer in clinical psychology at the University of Queensland, where his research continues to push the boundaries of how we understand and treat mental health conditions. Our conversation explores a nuanced perspective of anxiety treatments, consideration of both CBT and ACT approaches, and how we can better support children through evidence-based models. I really enjoyed speaking with Dr. Byrne, and I'm excited to share our conversation with you. So let's jump straight in. Simon, a big thank you for coming onto the program today. I'm really excited to talk about anxiety treatments for children in particular. I think there is a staggering need in our community at the moment. I can speak purely for myself and the volume of referrals we get to my clinic. This is something that we face daily, and I think that's not even representative of the need. There's so much out there. So I really do appreciate you coming onto the show and discussing this topic and looking at what this space holds and also how we might be able to look through a lens of different treatments and approaches and the like. So appreciate it.
It's a pleasure to be here.
Maybe we can start. I like to tend to start with how did you get into this space? Where did this interest come from before we kind of delve into it a little bit?
I guess as a kid growing up, I was a kid that was a bit more of a warrior and a kid who was a bit more on the nervous side. I wouldn't say that, stopped me from doing things in any great way, but I certainly noticed it in certain areas of my life. So I was a very keen cricketer as a kid, and I'd say I had a reasonable amount of talent for that. And I was actually a wicketkeeper who tried to bat. And when I was a wicketkeeper, I guess I'd say I was very proficient. It was something that I could do all day. I could do it very effectively. And it was something that, I always felt very confident about. But I'd say with my batting, it was a very different story. That when I was in the nets and when I was practicing, I was completely fine. My technique was sort of reasonably good. I was hitting the ball well. But then when I went out into the middle and actually had to face the bowler, I was completely useless. I regularly got out very cheaply. I'd often sort of thought myself out before I even faced the ball. And it kind of frustrated me that on the one hand, I was highly effective as a wicketkeeper, but really struggled as a batsman. And it seemed that no matter what I tried to do, I guess I'd learned about breathing techniques, things like that, and visualizing, there was nothing I could really do to shake it. So I guess that's where some of my early interest was sparked, in studying anxiety.
It's such a common experience, and sometimes because it's common, we tend to just push it aside and say, that's just normal. And although it is normal, it still has an enormous impact, from the individual. There you are standing, looking at this performance and you're demonstrating capacity in the nets, you're demonstrating capacity, whether it's behind the wicket, But when it's time to actually present, when everyone's viewing, it's time to actually, score runs on the board, something changes. So
Yeah.
quite interesting.
Yeah, no, it's yeah, for me, I think it was very difficult to explain. And it wasn't something that no matter what I did, I mean, no matter how much I practiced, um, or different strategies that I put into place, it always seemed to cause significant problems, at least in that particular part of my life.
And maybe you can talk me through a little bit about how this personal reflection, led then to actually going out and not only becoming a psychologist, but also, a researcher and looking at this specifically.
Yeah, so I guess while I was going through high school, I developed an interest in clinical psychology. I think it was an area where I felt I had sort of natural uh, talent in. It was something that I could contribute. I certainly felt that, yeah, I wanted to be in a helping profession where I could actually make a difference in people's lives. So I remember when I sort of finished high school, I started uni, I was working as a research assistant in different roles and for different people. I started to see different contexts where psychologists could work. And I guess on the one hand, there were areas, particularly in one of my early roles, I was working in a psychiatric hospital, a big psychiatric hospital, and there were a number of psychologists there. And I admired what those psychologists did, and I thought it was extremely important. But I also noticed that a number of the people that they were seeing, they didn't make a huge amount of progress, or you couldn't actually see that progress, and perhaps it wasn't always tangible. So that was, I guess, something that I felt I would find difficult during my career if I had to, pursue a career working in those very complex and difficult areas. But I also had the opportunity to work in anxiety clinics and work with psychologists who treated anxiety. And I think there were a number of things that drew that to me. One of them was the fact that the majority of those clients that came into that service, if they engaged and if they tried and they had a psychologist who they developed some sort of rapport with, they did get better, and they did improve. And I think that was something that I thought was important to me, that if I was to work as a psychologist, I'd need to at least feel that I was making progress, and that I was actually helping people in that space. One of the other things I noticed about working with people who are anxious, and this is a very broad generalization, but I guess they're more on the sensitive side. They're more on the conscientious side. So you end up working with people who are very engaged, people who want to get better. They're often people that I find very likable. They're really people that I guess you feel that you really want to help. So I guess those two factors sort of drew me to this particular area. I could particularly see, I guess, when I was maybe finishing high school or early high school, the revolution of cognitive behavior therapy was, very much in its heyday, that we were able to use, particular skills. These were evidence-based. These were processes that we could understand in terms of, what's happening with someone who's experiencing anxiety. And we could use that knowledge to treat people effectively. And yeah, something about that approach made it very attractive to me.
Hmm. It's interesting. I feel like there's been a certain pattern that emerges as well, and as you say, it's a generalized view, but there certainly is a lot of that trait of conscientiousness that goes with worry,
Mhm.
around whether it's that tendency to have particular standards and trying to meet them, perfectionism, those types of qualities, which are remarkably well received in a workplace. For
Yep.
example, you can see, particular staff working back late and trying to get things in order and being very, very considerate about how everything plays out.
Yep.
But at the same time, you can see a toll that they can potentially have on the person. There's quite a lot of, whether it's stress or
Perfectionism,
angst,
burnout.
yeah, burnout, concern. So that tends to show up, and
Yep.
that's speaking only anecdotally, but maybe it has something, and maybe the research says it. Maybe you can tell us a little bit more about the research and your work as well.
Yeah. I mean, I guess we know that there are a certain pattern of behaviors that people who are more anxious experience. So if we think of anxiety as an adaptive process, it's more or less a want to identify potential threat, to prepare for that threat, and to take steps to try and meet any challenges that someone might be experiencing. So, in that regard, people who are anxious and people who are more sensitive perhaps are in a better position to manage, a number of the challenges that people experience daily. So, if you compare that person perhaps to somebody who's very relaxed, very laid back, perhaps they have a more easy existence, but in some ways, it's an existence where they're more at the mercy of things that could happen around them. On the other hand, as you say, people who are constantly anxious, people who have taken perhaps that adaptive process and it's been overloaded, then that can become quite a difficult place. So we know that what can happen is that somebody who's a bit more on the anxious side, they might be better at detecting, responding to initial threats. But, if that becomes compounded, such that they're, constantly feeling that they need to respond to challenges, difficulties in their environment, whether they're real or imagined, it can kind of lead to a downward spiral where they're more and more stressed, they're more anxious. As a result of that, they're picking up more cues from their environment that would suggest that they need to be prepared. So, yeah, I guess like a lot of traits that people have, in many circumstances, they're adaptive and they're helpful in terms of our survival. But if they're pushed in the wrong direction or they're pushed too hard, these types of problems can also lead to a more maladaptive response, something that needs to be actually managed. So yeah, it's an interesting field in that way. I guess if we compare it to the other mental disorders, anxiety is something that is an important part should be an important part of everyone's life to some extent. You should be, in some circumstances, preparing for things. You should be, in certain circumstances, highly conscientious. But if that becomes too much, or the pressures faced are too much, it can be also something that leads to, disruption, impairment, and I guess the growing burden of anxiety in our society would speak to that.
It's almost like there's a dial or a volume of sensitivity towards perceived threats.
Yep.
And if the dial is very high, so very sensitive, there's a greater possibility or opportunity to sense an imaginary threat rather than a genuine threat. And it's hard to also understand in this complex world which one's which, and the medical threat is a classic one. We see lots of health anxiety, and there's an unlimited number of scenarios where people will say, yeah, this experience was happening for my child, for example, and I went to the doctor and they gave me plenty of reassurance. And it ended up being that after 6 months we found X, and so that then reinforces that sensitivity, that there's a function to it. And in that case, absolutely. Yet in another case, which I'm sure we have confirmation bias that we forget, we don't go out and say, oh, I had this fear and I had this fear and I had this fear, and none of those things. As a matter of fact, there was probably thousands of those cases. None of those occurred that I entertained for an extended period of time. There's some volume going on.
Yeah, certainly. An analogy that I've heard is it's like a car alarm, and some people have a high level of sensitivity, such that if a leaf drops on the bonnet of that car, it will trigger that alarm. Whereas other people, can have someone who's trying to pull off the door, but nothing actually comes off it, and that alarm doesn't get triggered. I guess it's in some ways you could say a balance between those. We need people to have an appropriate level of caution. We need people, for their own survival, to be able to, I guess, respond to threats as they occur. But at the same time, if that response is being continually triggered, one of the difficulties is it's more likely to get triggered again in the future. So I guess for people who are experiencing that high level of sensitivity, learning ways to try and manage that is usually something that's very helpful.
There's even one other scenario that came to mind as you were talking about the analogy of the car alarm, where the alarm is going off and everyone can hear it, and there are people telling the owner the alarm has gone off, and they're saying, I don't want to hear about it. They cover their ears, and they say the anxiety of even knowing about it makes me want to avoid. I don't want to even hear it. So it's not like the sensitivity. There's actually a sensitivity to hearing it and saying, I don't want to deal with it. It might be serious, but that would be worse than
overreacting,
turning a blind eye.
Yeah. I mean, I guess one of the things, I guess the fundamental thing that I would say I've learned since I've been studying anxiety, both in adults and children, and this is backed up by 100 years of science, but avoidance of a cue. It's that avoidance in that case, if it's with a car alarm that needs to be attended to. It's that avoidance that maintains the anxiety. So in the example you gave, perhaps that person who's doing their best not to hear this alarm that needs to be responded to, that might make them feel better, at least in the short term, that they don't have to deal with this thing that's come up. But the reverse of avoidance is obviously exposure. So being able to gradually respond to things that we find anxiety provoking, things that make us, feel a level of discomfort, that's very much at the heart of treating anxiety. And I guess if there's any one process of all the different tricks that we have for managing anxiety, it is that exposure to these cues, doing it gradually, doing it gently, in a way that the person experiences some distress, but it's manageable and it reduces. That's very much at the key of treating anxiety, and that's very much what my research is focused on.
Can you talk a little bit about the idea around exposure? And I ask this because I come from an ACT,
Yeah, I
very
know.
much ACT informed
Yep.
approach,
Yep.
and exposure more often than not does create symptom reduction.
Mm.
It seems to me, my observation is that there are certain occasions where the symptom reduction might not be very much, irrespective of the great volume of exposure scenarios. And I've worked with clients where we've set the number to something as high as 500.
Yep.
That sounds very high, but in actual
So they've
fact,
done 500 exposures? Is that
500 exposures.
wow? Okay.
And without going into the case,
Yep.
there has been great functionality that, well, let me rephrase that, much improved functionality,
Yep.
but still quite often a very significant, large visceral response.
Yep.
And that's among many things.
Yeah.
I wanted to get your thoughts around the use of exposure. And I'll put my hand up as well when I jump in an aeroplane. Not that my exposure rate has been ginormous, but
Yep.
I've probably been in an aeroplane 50, 60, 100 times, maybe more.
Yep.
I know that the rates are very far apart, so that probably does not help. But I still get this fairly strong response, sweating, heart
Yep.
racing. And I'm I'm a happy flyer in terms of I'm very willing.
Yep.
It's just so unpleasant.
Yeah. 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 I mean, I guess since I've started as an academic here, something that I have to deal with very regularly, there's no way to get out of this, is to public speak and to teach. And that's something that I would say I've improved on, and I'd say that my level of fear and anxiety as I do that has certainly decreased over time. But I'm always surprised that no matter how many times I do it, when I get up there for the first class, it always picks up, and it always becomes quite uncomfortable. And then I guess it settles a little bit as I continue. Um, Yeah, I guess for me, my experience of exposure is fairly textbook. That if I haven't done any public speaking for a little while, and then I have to teach, it will be elevated. And then over the course of the semester, as I continue to teach, it kind of tails off and it sort of gets a little bit better. But I'll get a bit of a break in the middle of the year, and then I'll have to come back and do it all again. And it would be more or less the same thing. It would peak. It might sort of reduce a little bit more quickly, but I always experience some spontaneous remission. And I was sitting next to a colleague who is a professor who constantly has to public speak, and we had to sort of get up briefly and talk for a few minutes about something. It was just in front of a group of students. And yeah, I don't know. Certain situations particularly throw me. I guess I want certain things. Like, for example, at the moment, I'm holding a pen, and that's something that I typically do when I public speak. But in this particular circumstance, I wasn't able to do that. There wasn't one around, kind of thing. So I kind of had to get up and I had to try and wing it. And I was probably a little bit more anxious, but I managed to get through it. And I was feeling a little bit more self-conscious. And then my colleague she did the same thing. She got up and made this talk. It was to a group of maybe 30, 40 students. And then she sort of finished. She looked fine. And then I remember she turned to me and said, like, God, I hate doing that. You know, every time I do that, it makes me feel crap. And it was interesting that someone who was sort of that senior to me sort of still had the same experiences to me. Um, yeah, I guess in terms of your client, it's difficult. And I mean, it certainly takes a lot of courage for them to persist with that. Um, Especially if they're not feeling that, you know, it's perhaps going as quickly as it could. I mean, I guess there are some people I work with, some kids, and it's interesting. I'll do, say, be working with a child and a parent, and the child is socially anxious, so very shy, and they struggle with that. And I'll sort of work them through sort of some basic exposure exercises. And then sort of just like that, they seem to improve rapidly and currently, and they feel, you know, confident. They're suddenly back at school. They're doing very well. The mum's reporting, you know, that, you know, the child is significantly improved, as almost as if they don't have a problem or they never have a problem to begin with. But then there are certainly other people I've worked with where it's really hard work. It feels like, you know, progress is slow, perhaps progress is minimal when you think you've made some reasonable progress, but then they come back the following week. It kind of feels like you're back where you started. I mean, for clients who are experiencing that, I guess for me, I would be sort of looking at, you know, are there things that I could perhaps manipulate in their environment to perhaps make that exposure take a little bit more? So are there small subtle cues? Are they sort of practicing exposure to one particular type of stimulus? And perhaps they're having return of fear because they're then approaching a different type of stimulus, perhaps in a different context. Sometimes some things that I find helpful are, I guess, those cognitive techniques on top of that. You know, are there any things that you could try and change the way that that person is thinking while they're conducting the exposure? Yeah, there are certain things. I know with some clients, though, it is just hard work. You have to try and persist. You have to roll with whatever they're experiencing while they're doing. You want to push them a bit, but not too much. Yeah, it's certainly not an uncommon experience for a psychologist to have to work with a client like that.
I've always found it interesting, at least in my ACT approach, in I'm quite methodical about trying to be thoughtful around the goal of exposure to create functionality rather than symptom reduction.
Yep.
But I can also see how enjoyable and enticing and the natural yearning there is for a reduction in discomfort, a reduction in pain, whether it's physical sensations, a visceral response, or whether it's from a cognitive space in terms of not having to deal with those thoughts, and how enticing that is to then offer the concept, the idea of exposure leading to symptom reduction means good.
Yep.
And that setting up the client for a possible later lapse, you know, because it returns, and that means it's bad, and hence why I think the ACT approach has resonated so much with me.
Yeah.
The concept of being doing these things for functional reasons, and obviously a values perspective, like, you know, whether it's freedom or you know, having more opportunity and choice in life, being able to visit, let's say, for example, a family member, if it's kind of like an agoraphobia type experience,
Yeah.
whatever the value is, uh, but trying to steer away from the symptom reduction only because, like my own experience of flights, I'm always concerned that if it doesn't do that, and if it doesn't symptom reduce and it doesn't sustain that, there's an inadvertent messaging that it should sustain it,
Yeah.
and that if it doesn't, it's abnormal. So it's a tricky space that I'm always balancing. I'm always thinking about, because I find that difficult in terms of what's the unintended message that might come from, how I present exposure therapy.
Yeah, and I guess it's something that cognitive behavior therapy is or has been accused of, that it's sort of, I guess, taken, fear conditioning paradigms from working with animals and then, tried to apply that to, people who have a variety of different motivations and experiences. Um, yeah, so it's something that I guess we certainly need to be mindful when we're working with clients as to, yeah, what is the purpose of this? How does this improve their life? We don't want to sort of just finish, a good exposure hierarchy and 6 sessions of cognitive behavior therapy and, smoke a cigar and say, we've done an awesome job here. Um, yeah. How did you get into acceptance and commitment therapy?
Guy, like many, uh, there was, especially here in Australia, I think Russ Harris was doing the rounds and continues to do the rounds, and so that was one of my first exposures. I very much already had quite a leaning in having read a reasonable amount of literature in Buddhism. There
Yep.
was some overlap in that space,
Yeah.
and so uh, the uh, the observations that I was having, both within myself and also with my clients, allowed me to expand on what I thought CBT was exceptional in. I felt that it just added an extra layer, and I've changed my reasoning, my thoughts many a time. I used to, like many of the uh, 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 cult members of ACT, when you first get in.
Yeah.
It takes a little bit of time to ripen and see the immense value that both have, and in actual fact, how more similar they are than they are different.
Yep.
And I know that Steve Hayes has written a book with Stefan Hoffman around. I think it's called process-based CBT.
Yeah.
There's more to say about the principles of psychology rather
Yeah.
than this sort of a ridiculous notion of one against the other.
Yeah.
We're trying to all borrow from the scientific knowledge and
Mm.
and apply it to the best of our ability, and I think both are valid.
Yeah.
And so much more of this is about the delivery of how
Mm.
a psychologist delivers messages uh,
Yeah.
that are actually consistent with both. And that's why for me the inadvertent messaging, this sort of secondary message that might occur, which is happening, I think, constant in sessions, whether it's an ACT approach or not.
Yeah.
I'm always worried whenever my client comes back and says, Nesh, that thing you told me to do last week. And I'm like, oh, what was the thing that I told? Like, because that's not really what I did, but,
We'll take
brace,
it. Yeah.
but even when it's a positive thing, it's still concerning,
Yeah.
because there was something that was taken away that I might have laid that out more as in something to consider or something to think about, something to chew on.
Yeah.
But that's how I got into it, and I very much have maintained a very strong bias toward that's my practice.
Yeah. It's interesting for me because I guess where I did my postgraduate training, there were a number of very prominent clinical psychologists, but they were very much CBT focused. So that's, I guess, something that you get brought up with and you kind of internalize. Yeah, but it was, I guess, talking to colleagues as well who were, heavily focused and motivated by cognitive behavior therapy. There was a sort of notion that, ACT and mindfulness and these sorts of third wave therapies, they were sort of a passing fad, and that, there'd been one of those, pretty much all the time since cognitive behavior therapy had, begun. But it sort of appears like that certainly wasn't the case, that these particular approaches to treatments or ways of thinking, they seem to be very powerful and they resonate with a number of people. And again, I'm not somebody who's a huge proponent of ACT. I'd say I'd use a little bit here and there. I dabble in it, you might say. And my wife is Buddhist, so perhaps I'm influenced by that a little bit. But I did a sort of research fellowship in a drug and alcohol uh, health service, and I sort of had an interest in these things, but I didn't. Part of my reasoning was I didn't know a lot about it, and I'd like to learn a little bit about it. And I ended up looking at the efficacy of these third wave therapies for alcohol use disorder. So there weren't sort of many reviews at that particular time. And again, there was a bit of a reluctance, but for me, it was interesting that that evidence at that point certainly indicated that these treatments were well, at that point, they were considered to be, using the scientific language, better than no treatment or treatments of minimal efficacy, which was to say something at that point. And last year I published another review looking at this topic once again, and at that point, I guess the conclusion was, well, they're similar in efficacy to effective treatments, including cognitive behavior therapy. So while it's not my thing, you do have to look at some of the evidence that is out there. And, as a scientist, I shouldn't just adhere to a doctrine about what I was taught maybe 20 years ago.
And the beautiful thing I think about CBT is the grounding that it has. I've always thought about it in a sense of CBT is kind of what we do every day. It's inbuilt with the logic that we are offering to one another, as whether it's parents or as friends.
Yeah.
And more often than not, it works exceptionally well. And it doesn't even need to be from a therapist. It comes from, wise counsel, a good friend, a teacher, a parent, our own general thinking. We use logic all the time. And I think logic applied over and over and over again is very solid, because we do need to be reminded so many times.
Yeah.
And I think sometimes, though, I think CBT can still be in many ways consistent with ACT, in that CBT can still go out and say one logical thought can be that a thought is a thought. And so even then you could turn CBT to be ACT consistent, not needing to necessarily be challenged.
Yeah.
And that is potentially the challenge, right? The thought, the cognitive restructuring. So this is where we can kind of get into the semantics. And I know there's a lot of difference, but there's also a lot of similarity. And this is why I feel that, generally speaking, those things have merged as we've all become more and more exposed to really good logical arguments, observational truths, if I can call them that.
Yeah.
the research going out and demonstrating those things, we can see merit in both. Similar to lots of things, not that I'm an economist or anything of the like, but I'm sure there are similar scenarios in other industries and fields where you say, yeah, both can be valid, or they're both speaking to the same thing,
Yeah.
but they're
Yeah.
different as well. And so, to go out and degrade one, it just makes
Yeah.
no
Yeah.
sense.
Yeah. I think that's where the danger lies, especially if people strictly adhere to one with the exclusion to the other.
Yes, yes,
Um, yeah, it's I guess one of those things that perhaps at the end of the day, if you wanted to use any sort of benchmark for any type of treatment, is does it actually help this person? Do they experience some sort of remission or reduce suffering or reduce distress or something like that? Um, I know when I was looking at the use of ACT for alcohol use disorders, one thing I guess that I would I would hazard to guess one of the reasons that people might find this more attractive is perhaps it is a little bit more humanistic than cognitive behavior therapy. It does sort of, speak to the notion of human suffering and the need to, I guess, respond to that. Whereas, if you've got something highly clinical, perhaps someone whose life has been really turned upside down by this addiction, it may not appeal as much to them. So it could just be that perhaps there's similar mechanisms, but perhaps one of them is more acceptable to people more generally. But it's certainly, interesting space that I've kind of grown up with as I've been, trained, and I continue to work in the field.
And what are the uh, are there different approaches for? I know that you have a bit of an interest in treatments for children. How does that differ from adult treatment in terms of, what is the literature saying? What's been your
Yeah.
experience? How do we approach it potentially differently for, some children are going to be less cognitively capable, as an example, than obviously their adult counterparts. Maybe you can talk to that a little bit.
Yeah, sure. I had uh, one of the senior academics in a department that I was doing my PhD. He was, I guess, a very strong proponent of cognitive behavior therapy, and I guess he'd watched, the fruits of that throughout his career. And his description was the treatment of anxiety in children and adults is pretty much the same, except the children are smaller. So, you use pretty much the same techniques to treat both groups, but perhaps you tailor it a little bit more towards, a child depending on their developmental period. So things like cognitive restructuring, which has shown some efficacy, particularly in adults. For a kid who is younger, you might need to make that a fair bit simpler. You might need to break that down. For a child who's very young, they may have difficulty actually separating thoughts from themselves, in which case you'd have to, I guess, think about whether or not this is an actual worthwhile pursuit. There's certainly elements of these treatments that I guess people would say they work along the same therapeutic paths. However, they need to be tailored a little bit more towards children. Certainly for both groups, exposure therapy is the most effective thing for treating anxiety. One thing I'm interested in is how parents could be involved in the treatment of anxiety. So I guess when you have an adult, you're typically working with them independently. trying to get them to, gradually approach this situation or this experience that they find distressing. But for a child, it may be helpful, or it might be your only option to have the parent do this with the child. So in this case, it's not always simple and it's not always easy. And certainly there's a lot of literature. There's been an ongoing debate for a while as to whether or not it's a good thing to have parents involved in child anxiety treatment. But you do need to coach the parent, tailor that exposure therapy with the parent so that the parent can effectively conduct that exposure therapy with their kid. So if you've got a child who is not going to sleep or sleeping in their own bed, you've got a child who's not attending school, a child who's having difficulty talking to other people, a child who's quite shy, getting the parent who's there all the time to step in and try and promote that exposure with their child. Yeah, and there's, I guess, it seems like the most logical approach. It's not as simple as it might be. My experience is working with anxious kids. It's better if I do the exposure therapy myself. But if you are to get the parent there, you need to make sure that it's being managed properly, because sometimes what can happen is the child becomes distressed. The parent swoops in, they hug each other, there's tears, and then you sort of cease the exposure therapy at that point. So it's it's an interesting field and an interesting area, but I guess if we think about what your role is as a parent, it is to really comfort your child, make them feel safe, empathize with what they're experiencing, but then to, push them to keep trying and to experience challenges and experience a manageable level of distress.
I can see the complexities because the ideal is so far from the observational truth. And if I just even think of myself as a father, and I am so actively thoughtful about the messaging and how I do exposure, because I'm just doing it all the time, whether it's the way I say something, whether it's me injecting ideas or trying to put things forward, the way that I tease my children, all these things, I don't know if it's uniquely for psychologists or just myself or for parents. We're so invested that we're wanting to teach all the time, but I'm very conscious of they can't be teaching moments. They have to be organic, at least in the experience of the child. For me, I'm just constantly thinking about things. So, whether it's normalizing something or going, oh, well, it doesn't matter, trying to do lots of acceptance work, trying to do diffusion with my kids by, teasing them in different ways and then actively getting them to role play it. There's an infinite number of things. And even then I still feel like I'm getting not much traction. But
I have a 2-year-old daughter, so I'm still sort of relatively new to being a parent. But I guess she goes through phases of being anxious about certain things. But at the moment, it's bugs, so insects. And both my wife and I, she's a kid who likes having friends, and she's sort of big on that. So we're trying to say to her, well, no, that bugs your friend. Like, you should try and be friends with it. So it's quite cute. She kind of waves at it and and says, hello, bug. They're sort of lizards. So she's waving at them. We even had a cyclone up here in Brisbane. It wasn't as bad as we thought it would be. But there was kind of the joke that she would be saying, hello, cyclone, you're my friend. But trying to just instill in her, at least for me, not to be fearful, not to avoid. If you fall over, try and get back up. I'm very conscious of that.
Mm-hmm. And also taking the power away of or from things that are painful or concerning. Sometimes I feel like we as an industry can naturally, and as people who are compassionate and caring, just like parents, we want to swoop in and
Yep.
soothe, and and
Yep.
and sometimes that robs the opportunity, or reinforces the message of yes, you're not supposed to feel that,
Yep.
versus yes, you are, and through that you learn how to self-soothe,
Yeah.
and allowing for those things to occur, and that's where I think the complexity of whether we're working with children or whether we're working with the parents or both is quite complicated, because the theory is great, but the
Yep.
the
Practice.
the practice, has got so many fault lines.
Yeah. 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 And I mean, I think certainly uh, one thing I think is important is when you're working with a family or you're working with a parent and you can see their child is highly anxious. I guess there has been a bit of a temptation to say, well, your kid is anxious, one, because they inherited your genes, and then two, perhaps because, uh, you could be doing things differently to reduce that. So I think getting away from that notion is really, really important, I think, for the family and for their relationship with mental health professionals.
And also because it's so easy for us as parents, as humans, to we already do so much judgment and internal critique, and then we go out and say, well, I'm somehow responsible, uh,
Yep.
versus saying, there's ingredients that you can put forward that may assist your child in being more adaptable, uh,
Yep. Yeah.
learning some things so they're not as concerned or frightened or worried, or
Yeah.
they develop a perseverance, a willingness to sit with discomfort. Um, there's a particular model. I'm not sure if you're aware of the model. It's an ACT consistent model,
Hmm.
that I think it's Joe Cherokee, from, I think he's still probably in Wollongong University, maybe not,
Hmm. Yep.
um, and Louise Hayes. I think it's
Yep.
them two. I don't know if there's a third. I think it's just them two. A model called DNA V, uh, and the D. This is for working with anxiety with children. The D, or other difficulties as well, but the D is for the discoverer. I hope I've got this right.
That's right.
The N is for the noticer. The A is for the advisor, and the V is for values. All thinking
Hmm.
might be vitality and values. And this bringing this language forward about there's these different modes, or different voices, different parts that you can tap into, whether you're
Yeah.
an observer, um, being, the noticer in that sense, whether you're the advisor, but then you've got to kind of go, do I diffuse or do I take that on board? So you're kind of observing the advice that you're being given,
Yeah.
obviously values and so on. It's quite I was going to use the word cute, but it's not cute. It's quite brilliant,
Yeah.
in how we can deliver a different language set.
Yeah.
And I'm familiar with that a little bit. I don't work with children, but I'm familiar with that a little bit versus the CBT equivalent.
Yeah.
I can see the importance of trying to find a language set or a delivery mode that's consistent for kids.
Yeah. Yeah. Certainly. And I think that's, again, I'm less familiar with third wave therapies and use them less, but I think a strength is that they do provide these analogies and these ways of thinking about people and the human condition, and putting it in a way that, is able to engage. And I think that's certainly something that's really worthwhile.
What are the other frontline approaches? Is medication still a fairly common approach that we see in Australia?
Yeah, I guess if you have a child who's anxious, the type of treatment that they'll receive depends on uh, who they see. If they were experiencing a significant amount of anxiety and they were to see a medical doctor, then it's quite possible that that doctor would look to prescribe antidepressant medication, and we know that these medications can be highly effective. So I guess most kids who are experiencing anxiety would experience either that or receive either that type of medical treatment with an antidepressant particularly, or they would receive cognitive behavior therapy, preferably by someone who has a background in that and the treatment of anxiety. I guess I'm a clinical psychologist who works with cognitive behavior therapy mainly. I guess one of the advantages of that approach is that you can treat someone such that they learn skills, and hopefully after a short period, those skills will stay with them. So I guess that combined with I would say that that's probably one of the main reasons that would be my preferred approach. And often people would try psychotherapy or cognitive behavior therapy. And then if that problem is still not improving, they would look at other options.
Yeah, I always have my own bias in this space. That's a very tricky conversation to have because it still poses in my mind that concern that I have, which I've clearly raised already numerous times, the secondary message or the secondary gains, and there's so many challenges also with human experience kind of having a regression to the mean, and when studies are done, particularly even if it's a CBT study or whether it's a pharmaceutical study, if we don't do it a bit more longitudinal, we can quite comfortably go out and say, oh, look, within 6 weeks, we've seen these great improvements. And if you cut it off at that point, well, then so many things look great because of regression to the mean. And yes, we can still go out and say we'll put it up against, a no treatment at all or waiting list. But there's still that fundamental of, but there's improvement. And so how do I argue with that? And I think the common person, not saying that in a derogatory way, in a person who's not in our industry, who's very vulnerable, we just take that on without any further consideration. And there's a big nuanced and long conversation. And I'm certainly not even the right person to understand all of those intricacies because, the scientific method is so complicated and challenging in and of itself. But it's always interesting to hear other opinions, and I can see that for you, there's an importance around really trying to do any type of therapeutic approach, and whether it's in combination with, but that should still be the primary, because that's what parents have done all day, every day. That still has to be the primary approach, right?
I mean,
guide and support kids.
And what's the best outcome for a child? And I mean, I guess if you're going to take that approach, then if you're going to take that rationale, it doesn't really matter what you try as long as it is the best outcome. So I would certainly, if I was seeing an anxious child and their family, I would, discuss the different options that they have. But I wouldn't limit it to, what I could potentially offer to them. So I think, there needs to be an open-mindedness that parents and families need to be informed about these different options. And we need to remember that these families, they're often in a fair amount of distress at this time they're very concerned about the welfare of their child. So yeah, it's I guess it can be a tough area for families to negotiate.
And like everything, there's great value and great concern. I used to once upon a time, in a very naive way, big blanket ban, at least in my mind, around ECT, because
Yeah,
how could that possibly have any value or benefit
inhumane. Yeah,
until you go out and say, well, what do we use ECT for? This is absolutely last line defense.
mm,
And so any parent, loved one, good friend, sibling will throw anything at that given point. This
yeah,
is not a frontline first response. It's
yeah,
such great value for those who have benefited from that. So I think context
yeah,
is so important, and being compassionate rather than one size fits all. It's a personal, individual journey,
yeah,
and we're all none the wiser. We can
yeah.
only do what we can, and that's why it's a process.
And I
Um,
mean, I've worked with psychiatrists a bit, and they've been involved in administering um, electroconvulsive therapy to patients who I guess are chronically unwell, who are often at there's significant concern about their mental state or how they're going. And it's one thing, I guess, if I'd been asked about it before I'd had those experiences, I'd be thinking, one flew over the cuckoo's nest. I'd be thinking,
yes.
any number of movies that depict stereotypical attitudes about mental health. But I have seen with my own eyes many times that particular treatment is highly, highly effective, and it's something that I guess when there are limited options, it's really changed people's lives. So it's an interesting example. I guess what the public knows about it versus the realities of it. It can be very, very different. And of those treatments in psychiatry, it would be certainly up there as one of the most efficacious.
And that's the beauty of having these types of conversations, that there are so many novice ideas that I've had, and only through experience, whether it's
Mm,
through my own observation, similar to you, seeing
yeah,
the benefits of ECT, uh, and stepping away from these one flew over the cuckoo's nest, or whatever other uh, interesting but Hollywood designed programs.
yeah,
Uh, we're so blinded by those. So the importance of speaking with learned persons and the like.
yeah.
Where can people find out more about your research or treatments for anxiety in general, particularly around young people as well? I know that's quite a passion for you. Where would we start? Where could you potentially
Um,
guide listeners to?
yeah, I mean, I have a profile. I'm a lecturer at the University of Queensland in the psychology department. If anyone would like to contact me through that, I can also, Nesh, I'll send you the link to that profile.
Wonderful.
Um,
And
yeah,
we will connect that to our show notes. So for
nice.
any of the listeners, if they're wanting to, look that up afterwards, they can certainly do so. If they just look up neshnikolic.com/podcast, or just neshnikolic.com,
Yeah,
then they can find it there.
yeah, yeah. No, that would be great.
Wonderful. Thank you so much for your time and for your work, and being so open-minded. I think it's a beautiful way of even uh, looking at discussing topics like this an individualized approach for, even if we go beyond children, children being the predominant topic today, but just anxiety in its rawest form, still trying to find a way that we can go out and work alongside it, or even work past it, because that does occur all the time. Every day day, in Australia, that is happening.
Everywhere. It's all around us.
Yeah, and opening up that door of saying if you're potentially struggling, you're having a difficult time, there is perhaps possible opportunities, and some of them are with a psychologist, others are with a psychiatrist, a doctor, a good friend, through your parents, other loved ones as well. So, reaching out and starting that and finding your own path and journey.
Certainly.
So thank you, Simon. Really appreciate your insights and your willingness to talk about this. I think it's such an important thing that we can go out and do, and obviously continue to learn ourselves as well.
Thanks very much, Nesh. I really appreciate the opportunity.